Department of Surgery, I believe, is the third update on pediatric surgery, and they have gone a long way, and these teaching programs go a long way in imparting the surgical skills to the young budding surgeons. I'm happy to see that our medical college is providing a platform for such events, and I'm sure our budding surgeons will go a long way to propagate these surgical skills in their respective institutions. So I once again take the opportunity to congratulate the Department of Surgery and all the like branches with it, like anesthesia, who must have been giving the support for this event.
आज गवर्नमेंट मेडिकल कॉलेज श्रीनगर में हमने एक प्रोग्राम ऑर्गेनाइज़ किया था जिसमें ओबेसिटी, जो कि वज़न, मोटापा और उसकी सर्जरी के मतलब जिसको बैरिएट्रिक सर्जरी कहते हैं, उसके बारे में सारे डिपार्टमेंट्स मिल के उन्होंने अपना नज़रिया प्रेजेंट किया, ताकि जो पेशेंट्स हमारे हैं उन सब को ये बावर कराया जाए कि ये जो मोटापा है ये अच्छी चीज़ नहीं है और इसके लिए हम क्या क्या कर सकते हैं। जो बैरिएट्रिक सर्जरी इस वक्त दुनिया भर में और हमारे मेडिकल कॉलेज में फ्रीली अवेलेबल है पेशेंट्स के लिए, तो इसी पे आज हमने ये डिस्कशन किया। थैंक यू वेरी मच।
टुडे देयर वाज CMV on third bariatric surgery, and the Department of Surgery is doing wonderful job, and they have included especially this bariatric surgery. What does it mean? It is an obesity. The weight with the people who have the good amount, the overweight, and if nothing takes treatment, like there's a failure of medicine, and the last resort is surgery, and they are doing this surgery here with laparoscopic minimally invasively, and they have succeeded till now. They have done 68 patients. And this surgery is a very costly surgery, but here it is being done free. So I congratulate the Department of General Surgery and Minimally Assisted Surgery.
The patient before entering bariatric surgery has tried whatever evidence-based diets and exercise programs there are. We need to make sure, this is especially important for younger patients, that they tried the diets and exercise before entering bariatric surgery.
Glucose output. So many of these patients, there is one theory, the metabolic adaptation theory, why they gain weight, is that there is a dislink, there's a disconnect among these 3-4 factors. So they start gaining weight, and by the end of 2 years, if they have gained more than 20% of what they lost, probably you need to give drugs or you need to do a resurgery. That's one thing.
Touching heights in every aspect. Because it's not only in the field of obstructive sleep apnea where we are seeking your help, it's also in VATS where you have helped us a lot, both in diagnostic as well as therapeutic VATS, which you have started recently. So thank you very much. So first of all, again I would like to congratulate you that you have managed to get super specialty here, a multidisciplinary team here, which is the need of the hour for especially managing of these bariatric surgery patients.
They also have increased cardiovascular abnormalities like conduction defect. They are more prone to arrhythmias, pulmonary hypertension, left ventricular hypertrophy and dysfunction, and they have increased pre and afterloads. They are at an increased risk of aspiration due to hiatus hernia, diabetic gastroparesis, and increased abdominal pressures. Pharmacological prophylaxis against aspiration has to be considered with proton pump inhibitors and or H2 blockers and prokinetics. These are given 2 hours before surgery.
We have dates in our OPDs, and more and more of these patients are done. We have, done almost all the various types of procedures which are done internationally for these obese patients.
This is the data note on Jammu and Kashmir. This was published in the journal portion. It is a journal that is published by the National Institute of Nutrition. You will see the average obesity and overweight incidence in J&K, it is higher than the national average. So folks, brave up for the epidemic that we are facing, and we have to be up to it. To the treatment of obesity. Yes, metabolic and bariatric surgery is an important component of treatment. Endoscopic procedures are important. Pharmacotherapy has come up in a very, very big way. Ever since GLP-1 RAs have come up, it has come up in a very big way. And lifestyle modification is the basis of everything. Whatever surgeries we do, if we are not able to convince the patient to change his lifestyle, the bariatric surgery, everything is going to fail. So, as we see the indications and the magnitude of weight loss, definitely with metabolic and bariatric surgery, the magnitude of weight loss is more than any other treatment.
We got a